Welcome to the Happy Doc, the voice of fulfilled physicians. This show is about bringing inspirational, creative, successful, and happy health professionals to you. Get ready to learn how you can be a happy doctor too.
Hey everyone. Other than this week's feature, you may have noticed a new voice appear in this podcast. My name is Antonio. I'm the editor within the Happy Doc team and a senior at Temple University, majoring in kinesiology with a focus in pre-health professions. I am so thrilled to present this week's speaker, Dr. Kristina Dakis, MD. With her love of music and compassion for healthcare, Dr. Dakis shares with us how she maintained composure for exams and how she consistently drives herself forward in her third year of residency in family medicine. Furthermore, Dr. Dakis reviews some of her accomplishments and participations within and with the American Academy of Family Physicians, one of which is her advocacy to the National Conference of Family Medicine Residents and Medical Students. Now, just before we get started, please make sure you scroll down and give us some feedback in our review column. You may be featured within our next upcoming podcasts. So sit back, relax, and enjoy this week's episode with Dr. Taylor Brana and Dr. Kristina Dakis. Take it away, Taylor.
So, hello everyone. This is Taylor, and this is another episode of the Happy Doc. I am absolutely excited for our next guest, Kristina Evelyn Dakis. She's a third-year resident in family medicine, and something that I really love about Kristina is she started a student-run wellness program at her school, and she also wears many hats beyond just practicing family medicine. She also has an interest in maternal care, and I'm sure we're going to dig into all of that. But Kristina, can you say hello to everyone?
Hey guys, I'm excited to be here.
Awesome. It's awesome to have you. And, as I was digging through a lot of, the information that I found out about you, there's actually something I wanted to start off with, which is your interest in music. Can you explain a little bit about your passion with music and how that may have helped you?
Sure, I would love to. It's funny because actually I considered a career in music education before I found myself focusing on medicine. Music has been a huge passion for me ever since I was really 5 years old, and my mom brought me to my first piano lesson. Since then, I've added clarinet and saxophone as well, and throughout the years, music has really been that thing that has kept me grounded and brought me balance in all the work that I do and the studying and the countless hours on the wards. And actually, so much so that I ended up marrying a musician who's a professional saxophonist in Chicago. So I still get to come home to music every day, which is really wonderful.
Wow, that's amazing. And so something I would love to highlight here, or at least talk about, is maintaining interests in medicine. So for you, obviously, you do have this passion for music. Were you able to weave that into your schedule, during medical school and now during residency at your tail end? Have you been able to kind of incorporate that and maintain it throughout this whole part of your life?
Well, I haven't been able to incorporate it the entire time. I think sometimes it got challenging, and I definitely noticed that when music wasn't a part of my life, that I was more at risk for burning out. When I started medical school, right off the bat, it was, we're expecting you to study this many hours every night, and you better get this board score or higher. That's your only priority now that you're here. That's very much what it felt like. And I found myself really missing music because I did so much of it in college. So I got involved with our College of Medicine Artists Interest Group and met a couple other people, dancers, painters, people who also had this passion for the arts. And we really worked to find ways to have extracurricular activities and like open mic nights and opportunities for people to remember who they were outside of medicine and to really develop an appreciation for the arts. And that was one way that I really was able to keep music in my life. It was really rewarding.
Yeah, that's amazing. And like that's Something that I really want, everyone to hear is that maintenance of those core interests, because as you can agree, you can get really caught up in the monotonous parts of medicine, writing all those notes. And it's so important to keep who you are as an individual in the process, not just for like your own sake, but it's kind of boring if all you do is medicine. Wouldn't you agree?
Yes, absolutely.
I mean, like, it's cool. I mean, you're just always working, but I don't know. I just think there's something very personal about that. So that's great that you kind of maintain that in the work that you do. So I would love for us to kind of move on and discuss, what was your inspiration in developing the wellness program at your medical school and your interest in elevating the happiness of students?
Sure. So, it's interesting that you start off with music, because probably a lot of my initial interest in music and balance probably translated to me wanting to be involved with a new wellness program. For me, when I came into medical school, I actually was really struggling with test anxiety. So I've had my issues with test anxiety first starting back in undergrad, when I didn't sleep before my MCAT, and I was really nervous during the test, and I don't think I did as well on it as I probably could have had I taken time for myself and really addressed the struggles I was having. So when med school came around, and we were all M2s and preparing for step one, I once again was not sleeping before tests. I would be halfway through a test and I would be focusing on the clock, and if I was a little bit behind where I wanted to be, I would start panicking. I wouldn't be able to really like think about the questions. And I also noticed if I were in a 10-question block, and say I like the first 3 questions just happened to be really hard, all 10 questions would go poorly. Even though if it started off with easy questions, the block would actually go pretty well. And all these things were happening. And then, at the same time, I felt very isolated in this experience. No one was really discussing their emotional struggles, whether or not they felt like they were forgetting why they went into medicine to begin with, or whether they really were like worried about tests like I was. It just wasn't the kind of, it wasn't an environment where people were open about those sorts of things, even though honestly, going and sitting in a classroom for that long and basically being told that like your future depends on this one 8-hour test is pretty traumatic. And
yeah.
I remember the only time anyone ever really told us to take care of ourselves. Well, there were 2 times. One was at the bottom of a psychiatry lecture slide, and it just said one bullet point: the highest rates of depression are at the end of your M2 year.
Wow.
And then this lecture just said, be sure to get help if you need it. And then there was also like a step 1 prep, prep panel, and some like specialist in like examination prep basically said, oh, by the way, if you're having a hard time, like take care of that now before your test comes. And I just remember all of that and thinking, this just really doesn't seem right. And meanwhile, I decided to pursue therapy so I could finally overcome all of these like test anxiety things that I was dealing with every single time I was in an exam. And I went every week while I was prepping for step 1. It was hard for me to take myself away from the books, but I knew that this was something that was really important. I just knew I had to finally do this. And I would even take a test and practice like mindfulness strategies and relaxation techniques. And then I would bring them into therapy and talk about how it went. And basically what happened was I went from being someone who performed like around average to being at the top of my class on step 1. Like my score like dramatically changed. And it's probably unfortunate that I noticed that wellness was important because of grades, but that's the reality in medical school. And then I just saw this dramatic increase in my performance and realized, wow, this is something I've been missing for years. I've probably been holding myself back for a very long time. So
wow,
that's a very long-winded answer, but that was what I really wanted, to start the conversation and to create opportunities for people to actually talk about what they were going through and potentially even share strategies for success, because
Sure.
there.
So as I'm hearing this, there's a few things I wanted to kind of bring up. Number one is, for the listeners out there, if you're listening to this and you've ever experienced test anxiety, I would love for you to send us a message or ask a question. And Kristina, if you're okay with this, I would love them to directly ask you if you would want to chime in at some point and maybe do a little bit of a Q&A at some point, just because I think it's this is something that hasn't been discussed, specifically at least on this podcast. And I know for a fact so many people have test anxiety, including myself, by the way. When I took boards, like my step one, I literally slept maybe 2 hours. So I know that life for sure, but it's something we don't talk about openly. So I would love for listeners to chime in. And again, Kristina, would that work with you at some point?
I would be thrilled to talk to whoever wants to talk about it. It's an important issue.
Awesome. And then another thing too is I want to understand how specifically maybe what some of those techniques were. So just to give an example, let's say what were your changes in your mindset that you had a question in front of you, and initially before you did therapy and those types of things, you approached the question one way, and how did that change, or what kind of techniques did you use to change your mindset during those questions?
That's a really good question, and I think for me it came down to self-compassion, focusing on self-compassion. That was really what pulled me through. So before I started going to therapy and looking into ways to decrease my test anxiety, I would start off a test and say the first 3 questions, just by chance, because they're random, would be very difficult. And as I went through each question, I would tell myself, like, wow, you're not prepared. Like, you don't belong here. Someone let you into medical school on accident, like imposter syndrome, like thoughts. And those sorts of things really bring you down really quickly. And I think we're all perfectionists. We all tend to beat ourselves up. But for me, it was pretty, I don't know, it might have been more severe for me than for some people. But instead of thinking that way, what I ended up doing was a couple things. First, probably the most impactful thing was I developed a mantra for myself. So before every single test block, I sat there in the testing center and closed my eyes and said the exact same thing. And essentially what it said was, you've worked really hard to get here. You're really smart. You deserve this. You're going to be great. It's something like, I don't actually remember the specifics now, but I said that to myself. And then I also gave myself a hug randomly. I squeezed like myself and gave myself a hug and then when I also normalized it and said I wasn't the only one struggling, because I was surrounded by people who were also going through the test too. To kind of just, I think, normalizing suffering, and that we all, go through these periods of beating ourselves up, and, that also was really powerful. So that was most of what I did.
Sure.
And
wow.
Yeah.
So, and I really loved what you said there. I want to highlight kind of a big point that you said was self-talk. And I don't think we've actually discussed this, within the podcast per se. You said it yourself, like you essentially beat yourself up in the first 3 questions as you were taking this exam, right? And then once you started to be mindful, or you started to notice that self-talk, so recognition is the first thing you did, and then you changed that self-talk. You just said that you used mantras, and I just think it's so fascinating that the words you tell yourself actually have an impact on the way you approach questions.
Kind of scary, actually.
Right. Like it's just nuts that you have the same amount of knowledge in your brain, but all of a sudden, just because you decide to use different words, and you decide to maybe have a more positive outlook, that actually impacted your scores. You know what I mean?
And pretty dramatically. Yes. I
think it's fascinating.
Yeah, I really think it is too. I do have to just make a shout out. I actually read a wonderful book called Self-Compassion by Kristina. She's a psychologist. She is one of the founders of the concept of self-compassion. That I actually read that book while I was preparing for step one, and it taught me a lot of the skills that I used. Just wanted to throw that out there. I don't know if this is an appropriate time to give book suggestions.
That's totally appropriate. I think that was the most appropriatist, if that's a word. But yeah, no, seriously, that's awesome. And I think there's so much to be said about self-compassion, and that could be a whole other set of episodes. So yeah, that's awesome that you brought that up there, for sure. So moving along from test anxiety, that was one of your challenges. Give us an example of maybe another, difficult challenge through your experience in medicine or in residency.
Sure. So, I guess we can move ahead to residency. So, I've been telling this story a lot now, just because I was, really had a huge impact on my life. When I started my family medicine residency, I was, of course, really excited to finally have graduated from medical school and to have my own patients and to finally be doing what I'd always dreamed of doing. Then, unfortunately, 3 weeks into my residency, I actually was grounding, and I got a text from my mom that my dad was in the emergency room. And I remember, just trying really hard to focus on rounds. And of course, it's pretty difficult, but we work in this environment where, we push forward and we do our best to, pretend that we have everything together. And and then my mom ended up, contacting me later and telling me that he had a scan that showed basically a mass in his colon. He ended up being diagnosed with colon cancer. So
it's terrible.
Yeah. So, I went through my entire intern year with my dad also battling colon cancer, which definitely was not easy. I think it's definitely it's just crazy when you're trying to go about your day and do your notes, and then you come home and then it's like, oh, well, why does he have these symptoms, and why, you're a physician, you need to help us. So it was really difficult. In addition to just the normal stressors of intern year, and unfortunately, the cancer ended up spreading, and by the end of the year, it wasn't looking very good, and I really wasn't in a good place at that time. I think that was definitely an example of a time when I was burnt out. I remember toward the end of intern year having a really hard time empathizing with patients. If anything, I was just getting really just easily frustrated with them. I had forgotten a lot of the reasons why I'd fallen in love with family medicine to begin with. And to be honest, I often resented medicine because I was stuck in the hospital instead of being home with family a lot of the time, And it just, and also I was emotionally exhausted. I wasn't there. I wasn't present. I just wasn't myself. And I definitely, and I think with everything else going on, it was a real struggle. And I know a lot of people go through this sort of thing regardless of what's going on at home. It's just a reality of the world that we work in. But there were actually some things that really helped me come out of this. First, eventually in May, I realized, my husband and I were engaged at the time, and our wedding was 6 months in advance. And I finally just said, hell with this, let's just get married tomorrow.
Wow.
So what we ended up doing, I called my program director and basically said, I think I need a break. I can't come in. This is more important. And, my program was wonderfully supportive, and I'm very lucky to work in the environment that I work in. And we planned a wedding in 24 hours, and we got married in the hospital, and he was there, and the whole hospital got behind it, and it was a wonderful, amazing thing. But because I was finally able to say, it's time for a break. My dad was able to see us get married. And
wow.
in addition to that, I actually, because I just had some time away, I was able to focus on the person that I was outside of medicine and hang out with other people who weren't doctors. And it was just all very wonderful and very needed at that time in my life. Of course,
Sure.
I can, other things that of course helped me were just, reflecting on why I love being a doctor to begin with, but we can get into that later. I could talk about that now. I think it's also really important to take time just to reflect on, what brings you joy in your work, because it's just so easy to forget when you get caught up in the day to day, and we're so busy and we have so much paperwork, and especially as interns, it's just so difficult. It's really necessary.
Sure. Yeah, I was first off, I want to say thank you so much for sharing that story. That was a very, very difficult time in your life, and I really appreciate you sharing that with us today. I think it's so impressive that you went through intern year, which is a huge transition. I mean, I'm an intern now, and it's definitely tough. Initially to go from that student mindset to like actually putting in orders and having some sense of responsibility. So, I think that's pretty tough. And, again, something I want to highlight that I think you just did so great was, you recognized the fact that you just needed a break. And then I think it's pretty crazy and also awesome that you switched your wedding date and just decided to go for it. That was so cool. And I think that was really, intelligent too, because, you're recognizing the fact that you wanted your family to be there as soon as possible. And also that you needed that break. That was really great of you.
Well, thank you. I think it's just amazing how hard it is for us to say no sometimes, or just to say, you know what, I just need to stop right now. I think we're not raised to be like that. So I don't really know how it came over me, but it just did, and it was probably the best decision I've ever made, to be perfectly honest.
Wow.
Yeah, wow. I did also just want to mention briefly, I wrote a blog about like my father passing away from colon cancer and being an intern a year ago, and I actually had, it was crazy, a lot of people, maybe people I just knew, like acquaintances, people I'd never really been that close with, but people just contacted me saying, oh my God, I'm going through the same thing. And I was so touched by how many people reached out and said, I'm going through something so similar. Thank you for this. Like, that to me also really highlighted how much we need to be more open and more supportive of one another. It just, this whole,
Sure.
I think there's always, there's light in times of darkness in so many different ways. It's really, it's cool. It's beautiful,
Yeah. So, since you brought it up, how could someone find the article? Would they just search your name? Or?
Oh, sure. It's you don't have to read it. No, but
everyone listening, you must read
goodness.
this.
You can just search my name, and it's a Kevin MD article I wrote, I think probably a year ago now, actually.
Awesome.
Yeah, I guess Google me. Or
Google me. Perfect. So you will be Googleable, and we'll definitely look it up. That's great. Wow, what a story. And everyone, there's so many people going through tough times, and that's so great that you were able to connect, yourself with those people. I just think it's amazing how, these are normal experiences, but no one's sharing them. And you had the courage to bring it up, and then you form these connections. That I think that's just so amazing with technology and what it can do. It's like,
that's
so cool.
Also a topic for another time, I suppose. But yeah, it's definitely exciting how you're able to connect with people, and via social media. It's just a whole new world, really.
So you had brought up actually, going through those tough times of burnout and kind of essentially you're alluding to the fact of finding why you went into medicine in the first place. So like, why did you go into medicine in the first place?
Oh goodness. Well, I always love talking about this. So, when I think I mentioned this already when I was in high school, I actually was initially thinking about being a music teacher, but when my parents actually around then, that was when they started developing health problems, and right away it became very apparent to me how difficult it can be for non-medical people to navigate the healthcare system, and how valuable like a patient-centered, compassionate primary care physician is. They're actually, there's a huge shortage, and it's just really hard to find someone that you trust, who will sit down and listen to you, and who you feel comfortable with. And really from age 15, I was like, I really think I want to be a doctor, actually, and I really want to consider primary care. And then when I got to medical school, I was exposed to family medicine very early on. And I was very lucky to go to a school that values primary care and values family medicine. And I had amazing mentors, and I realized, wow, these people really have a lot of the same values and the same goals as I do. These people really think that more emphasis on prevention and primary care is the answer to a lot of our nation's healthcare problems. I was just really energized by the family medicine physicians that I worked with, and also I just really loved watching them interact with their patients and seeing the kinds of relationships they were able to establish with people. And I knew that was the kind of doctor that I'd always wanted to be. And so once I had my had decided on family medicine, I never looked back. But I guess that's how it started.
Yeah, for sure. And how did you spoke about your darkness. You spoke about a very dark time. What led you to kind of get out of that space, and find your why again?
Well, I love talking about this too. There were a lot of things in addition to being a part of a supportive residency program, but one thing for me was just taking time to step back and reflect on why I love being a family doctor. Really, my favorite part of what I do is deliver babies, and I have a memory that I talk about this a lot. I mean, because it was just so
sure.
It was just so fun. But my very first patient who I followed through her pregnancy, I just remember. I was managing her labor throughout the day, and she was only 3 centimeters. So I went home, and then of course I go home, and she goes from 3 centimeters to 8 in an hour, and I'm just like, oh God. And so I like rushed to my car and was driving through Chicago at like 11 o'clock at night, really fast, freaking out that I was going to miss it. And then I got to the hospital, and I remember just walking into the room, and the patient and her whole family were just so excited when I got there. They were so happy to see me. And that feeling was just, you want, like, that's just when you know, like, wow, this is literally where I'm supposed to be right now. This is what I'm meant to be doing with my life. And then of course, fortunately it was a lovely delivery. It's still so cool to me that I was the one that was able to hand her child for the first time, and now her kid's my patient too. So I get to I'm seeing him learn words, and it's just really awesome that we, at least in family medicine, we have just a wonderful opportunity to be a part of people's lives in so many different ways, and that to me was a memory that I really clung to when I was like having a difficult time.
Wow.
The other thing. Oh no,
that's awesome.
Thank you. the other thing that I did when I got to residency was I actually got involved with a national family medicine organization, Family Medicine for America's Health, which and I started a national project to prevent student and resident burnout with a fellow colleague, Joseph Brodeen, who just graduated from Georgetown. And we actually led workshops around the country talking with students and residents about, and also faculty about wellness and medical education and basically ways that we think we can improve it, and what we think the barriers are. And I found that trying to make a difference on a larger scale, at least in my own small way, was very therapeutic too.
Mm-hmm. Yeah, definitely. Wow. There's so many things I could say right now. No, it's great. I love this. And actually I did want to go back to, we were talking about word choice earlier, and at some point in the conversation you said that doing family medicine and being in this field, and especially you clung on to that memory, for example, that stuff was, you used the word energizing. And I really love that word because, big part of self-care is recharging and energizing.
Sure.
And, when it comes to living your life purposefully, you need to know why you're doing what you're doing. Otherwise, it's just a job, and if things are just a job, that never feels good. And I love the fact that you told this beautiful story, and you said it was, this type of work was energizing for you. And I just wanted to highlight that, because that's just so important when it comes to being well, when it comes to the work you're doing.
Yeah, I've never really stopped to think about how great that word is. So I appreciate you pointing that out. I think when we choose to become physicians, we are in some ways choosing a lifestyle. And I think we're very lucky. Medicine is more than just a job. It's a calling, right? So
right.
I think I'm very privileged that I get to play this role in people's lives every day. I mean, the things people confide in me about, the opportunities to reach and to be a part of people's lives at their most vulnerable moments. It's just amazing. It's really cool. Right. Anyway. Okay,
I love it. I know, I love it. I'm just, if I could take like a snapshot of like this entire conversation and just like take that, everyone should listen to that, because, okay, if you're a second year student right now, I guess they're not taking boards anymore. Well, some of them are.
Well,
so
they
yeah, so if you're a second year student right now and you're feeling burnt out, I mean, just listen to this part, or listen to these conversations, because, this is the point. Like, everyone, we're all, even as an intern, I'm stuck in the weeds, right? But, when you're stuck in the weeds, it's hard to see the big picture. But then you take someone that's a little further along and has a bigger scope, and you realize that there are so many beautiful opportunities in this field. And it's just so awesome that, you're telling your story right now. It's it's getting me very excited.
You'll be done with intern year soon. You'll be through with step one soon. It's worth it. I think that's probably the most important thing to remember. It really is worth it. But you have to stop and take time to enjoy your work. And then you'll realize it's worth it, and I know I don't always do that. It's very easy to get stuck in the weeds myself, even now as a third year resident, but it's important to remember.
Great. And I just wanted to touch on, so I know you've been doing a lot of, work when it comes into the wellness space. I know you worked with the American Academy of Family Physicians with wellness programs and things like that. How has that experience, working with the wellness programs, working in developing leadership in those programs, what have you learned along the way? And through this process that you love to teach or give to other students?
Sure. I think I've learned a lot. So basically, when we started this project, we really just wanted to raise awareness, because at the time people were talking a lot about practicing physician wellness, but I felt like medical student and resident wellness was kind of just getting swept under the rug, or just like included in physician wellness, when I feel like medical school and residency have their own set of stressors. And, people are burned out in medical school long before they ever enter an exam room, long before they ever have to deal with administrative burdens and the electronic medical record and all these other things that are, making it difficult to practice medicine. And I just was really, really amazed by the tremendous response that we got, the positive response, and how many people, came to our workshops and had things to say and were engaged and wanted to share their stories. When we really just wanted to have a single like safe space discussion for some students that are at the AFP National Conference for Residents and Medical Students about this topic and burnout and how we can prevent it as individuals. But then the Academy got so excited, we ended up posting it 3 times, and then
Wow.
it was like standing room only for the first one, and it just was really it was really exciting. And there were faculty there too, and people were really open, and they also had a lot of really great ideas. And since then, I think since then we've also met with faculty from different residency programs and medical schools as well. And probably one big thing that we're noticing is that there's a lot of things we can do as individuals, but also there's a lot of problems with the system, with the educational system that we train in. And if we are going to be well in medical training, we really have to address those too. So we're looking at really trying to change a culture at the end of the day, which I could go into in much more detail, but I think that was probably the biggest thing that came out of that.
I mean, I guess we're going to have a second. We're going to have a round 2 at some point to talk about. I mean, we've just been talking about you, but we could have a round 2 on the future of medicine, which is also very exciting for me. And obviously, I think we're both interested in. Wow, that's great. And so I guess, this is something I like to ask, each guest, but if you could leave, a student or a resident who's going and a practicing physician too, I know we talk about levels a lot, but to anyone who's going through a tough time right now, what's a tip you like to leave to those people that you're teaching and counsel?
Well, I think it's always important to remember that we are human, and if you're going through a hard time, take a step back and make sure you're taking care of yourself. If you are not able to take care of yourself, how can anybody expect you to take care of other people? And what about you taking a moment to make sure you're well? What about that will make you worse at caring for somebody else? If you went to therapy, if you, started a medication or something, if you did that, then you're going to be that much better at helping other people who are going through something similar, And just,
sure.
We are all human at the end of the day, and we're trying to help other humans. We're not perfect, but the work we do is really amazing. And also we all really need to be reaching out and supporting one another, because we're in this together. We don't have to be isolated.
Wow. I mean, yeah, I love that. That was great. Well, Kristina, Dr. Kristina Dakis, it's been a true pleasure to have you. It sounds like we're going to need a round 2 at some point. And for the listeners, I definitely, if you felt touched at any point by this conversation, I would love for you to send a comment, ask a question. It sounds like we'll be totally open for a Q&A or some sort of response afterwards. Again, Kristina, it's been great to have you. That was great.
Thank you for the invitation, Taylor. This podcast is really, really important. I appreciate all of the wonderful work that you're doing, and also thank you to everyone who's listening. We're all part of this discussion, so it's just sort of honored to be here.
Wow. Thank you so much, and take care. Hey guys, we hope you enjoyed this episode, and we want you to definitely subscribe to our social media channels. Check out The Happy Doc on Facebook, iTunes, Twitter, and Instagram. Please like, subscribe, share, and send us feedback. And please check out the website, www.thehappydoc.com. Again, we hope you enjoyed The Happy Doc, the voice of fulfilled physicians. Peace out.